As a medical practitioner, as a doctor, I have completed 25 years of my life in this medical profession. I feel being a doctor is a blessing, is a gift for my life given by the divine. In this medical profession, I've seen all sorts of problems, challenges, good and bad. So many lives has been saved. In so many lives, we are unable to save them. But one thing which pinches me often is when I come across the clients, the patients, the common public, when they cross to a emergency, specifically medical emergencies. So it is something very unplanned and it is sudden. How many of you can predict who might get a cancer, when we might get a severe trauma or an unexpected accident or some sudden health emergencies like heart attack or a stroke or something like COVID? The COVID has become so expensive treatment. When we get hospitalized, we spend thousands and lakhs. So these are all very unplanned, unexpected emergencies, medical emergencies, landing up in a huge medical expenses, right? So what is going to be there? Can I do something to my public, or can I do something to the people who are coming from a low socioeconomic status, who are in financial challenges, where I can really give them a rescue apart from my medical care? As a physician coming from the allopathic background, I see allopathic medicine and Ayush medicine as my two eyes. We cannot say which eye is important for you. For like both the eyes are so important for us. I see, I recognize both the treatments, I recognize both the medical facilities. Both are unique, both are complementary, and both are beneficial if you integrate them. I do this. When I do this, I see the happiness inside me. I see the blessings inside me. I'm very happy to see the clients recovering from some ailments which are getting reversed, which can be a lifetime challenge for them or lifetime expenses for them. Though these things are giving many happiness inside me, but still I feel I'm not complete. God has given me this profession and I'm able to extend this service related profession to so many people who are seeking medical attention. And on top of it, if I can do some financial support for some people who are having this sort of medical emergencies or unplanned medical treatments, or who have become financially challenged because of this medical expenses, I want to be a support for them. In that noble thought, we have started this GSSSS Clinics Trust. So this GSSS Trust is purely a charitable trust and it will have all the benefits from the income tax. Whoever are ready, I'll be the first person to put my reserve, financial reserve, the surplus money, whatever I get, I want to invest in this trust. I want to keep extend this people who are having this problems related to medical emergencies. It can be anything related to health. It can be a health screening program, community health challenges program, community health awareness program, or a free health screening, or some support for a specific people who are having these problems. So I want to do a lot of health supporting expenses which is unexpected, or people who are having coming from low socioeconomic status or from the financially challenged situations. So this will have a very unique model. I feel all the people who are in the medical side should have this thought. We should have a portion of our funds, because God has given this noble profession. We have extended this profession to the public, and on top of it, if we can do something as a charity from our reserve, which will help the people who deserve it, it is a service to the God for giving this profession to us. So I'm happy to do this to the public, and I will keep doing as much as I can. It's like people who are affordable are paying me, who are unaffordable are taking treatment from me at a nominal cost or free of cost. I want to do these services. My ALM Ayush Health and Wellness Ayush Centers and my GSSS clinics, I'm having a vision to go for a chain of centers across the Chennai, across Tamil Nadu, across South India, across nationally. If given blessing, I can even want to go international also. But it's all divine wishes. My thoughts are very clear. I want to do service in healthcare in both allopathy background and as well as Ayush background, and that integrative medical approach should benefit all the clients in a long term way to get complete recovery from the health, aiming towards wellness through our my ALM as well as GSS clinics. And in that situation, if any clients are having lot of financial challenges or coming from a very poor background society, I will giving this financial assistance through GSS clinics. It's not only from my side, from my locations, for my setup, or for my key treatments. I am ready to do for anybody who's having this genuine reason of this medical assistance. I will be definitely supporting them for their medical assistance. Looking forward. Thank you.